Cannabis is becoming increasingly common in the United States. It's readily available in many forms, from smokable flower to edibles. Many people use it recreationally. However, it's crucial to remember that cannabis is not without its risks. This is especially important as its use becomes more widespread. One of the biggest concerns is the rising number of people developing cannabis use disorder, or CUD. CUD is a condition where individuals have trouble controlling their cannabis use. This can lead to significant problems in their lives, affecting their work, relationships, and overall well-being. Despite its growing acceptance, it's essential to understand the potential health risks associated with cannabis use. This essay will delve into the various ways cannabis can impact your health, from your brain to your heart and lungs. Being informed is the first step towards making responsible decisions about your health. Cannabis use disorder, or CUD, is a serious condition that affects a significant portion of cannabis users. It's characterized by the inability to control cannabis use despite negative consequences. This can range from struggling to fulfill responsibilities at work or home to experiencing social problems due to cannabis use. Symptoms of CUD can be varied. These include experiencing withdrawal symptoms when not using cannabis, such as irritability, anxiety, and sleep difficulties. Individuals with CUD might also find themselves using more cannabis than intended or for longer periods. They may even unsuccessfully attempt to quit or cut down on their use. Several factors can increase the risk of developing CUD. One significant risk factor is early initiation of cannabis use, particularly during adolescence. Frequent and heavy cannabis use also significantly elevates the risk. It's essential to be aware of these risk factors and to use cannabis responsibly to minimize the likelihood of developing CUD. Cannabis directly impacts the brain, specifically by affecting the endocannabinoid system. This system plays a crucial role in regulating various functions, including mood, memory, sleep, and appetite. When cannabis is introduced, it disrupts this delicate balance, leading to a range of cognitive and psychological effects. One of the most well-known effects of cannabis is its impact on memory. THC, the psychoactive compound in cannabis, can impair short-term memory, making it difficult to retain information. This can be particularly problematic for adolescents, as their brains are still developing, and regular cannabis use could have long-term consequences on their cognitive abilities. Beyond memory, cannabis can also affect attention, learning, and decision-making. Users might experience difficulty concentrating, processing information, or making rational judgments. These effects can be particularly pronounced in individuals who use cannabis heavily or have been using it for an extended period. While many associate cannabis with relaxation, it's crucial to understand its immediate impact on the cardiovascular system. Upon consumption, cannabis, particularly THC, causes an increase in heart rate. This rapid heartbeat can be significant, sometimes doubling the normal rate. This increased heart rate also leads to a rise in blood pressure. For individuals with pre-existing heart conditions, this sudden spike in blood pressure can be particularly dangerous, potentially increasing the risk of heart attack or stroke. Long-term, regular cannabis use is associated with an increased risk of various cardiovascular problems. These include stroke, heart attack, and other vascular diseases. This risk is further amplified for individuals who smoke cannabis, as they also expose themselves to the harmful effects of combustion and inhaled toxins. So, when it comes to mixing cannabis with other substances, it can really be a recipe for disaster. It's not just about the immediate effects, but also the long-term consequences on your health. Combining cannabis with alcohol, for instance, can amplify the effects of both, leading to impaired judgment and coordination. And yeah, that can be pretty dangerous. Also, mixing cannabis with prescription medications can interfere with their effectiveness or worse, cause harmful interactions. So it's really important to be aware and cautious. Always consult with a healthcare professional before mixing substances. Your health and safety should always come first. Inhaling cannabis can pose significant risks. When smoked, it introduces harmful toxins and carcinogens into the lungs, much like tobacco. Over time, this can lead to chronic bronchitis, lung infections, and even a higher risk of lung cancer. It's important to understand these dangers and consider them when making choices about cannabis use. Cannabis use is also linked to various mental health issues. Regular use, especially in high doses, can increase the risk of anxiety, depression, and even psychosis. For individuals with a predisposition to mental health disorders, cannabis can exacerbate these conditions. It's crucial to be aware of these potential implications and to monitor one's mental health closely. Cannabis edibles come with their own set of hidden dangers. Unlike smoking, the effects of edibles can take much longer to kick in, leading to the risk of overconsumption. This can result in severe intoxication with symptoms like hallucinations, paranoia, and even panic attacks. Additionally, edibles can be easily mistaken for regular food items, posing a risk to children and unsuspecting adults. Always consume edibles responsibly and store them safely. As we continue to explore the effects of cannabis, it's clear that awareness and education are paramount. Understanding the risks and benefits can help individuals make informed decisions. Whether you are a user, a healthcare provider, or simply someone interested in the topic, staying informed is key to navigating the complex landscape of cannabis use. Let's commit to spreading knowledge and fostering a responsible approach to cannabis.